Hello and welcome to our COVID chat. This is NorthBay Healthcare's way to reach out to the community on important health information. With us today is Chief Medical Officer Seth Kaufman, and he's going to talk to you and then answer some questions. Take it away, Dr. Kaufman.
Hey, thanks, Robin. Good morning, everyone. A reminder that we right now are doing a monthly Doc Talk Live about COVID. We will be back on February 9th after today's session. I'll remind you again at the end of the talk. Thanks for joining us. My usual routine, I'll go through a little of the data, a few of the hot topics for the last few weeks, and then we'll go right into your questions. So the first hot topic for this week is that we in Solano, and we can see for California, that we have passed our peak on case rates. It doesn't mean there's still a lot of Omicron going around, a lot of new cases every day, but we've passed our peak of new cases on a daily basis. That also doesn't tell you that's an overall average, but we know there's still a lot of pockets where there's a lot of new cases every day. We're seeing at our peak in Solano County about 2 weeks ago, we were at about 1,000 cases a day. That's several times, about 3 times, what we saw during Delta and previous spikes. So an unbelievable amounts of new cases. Now we know that Omicron does cause less severe disease, but the hospitals are full because so many people have COVID. Now that we're 2 weeks out, for a few weeks out from that peak, this is when we start seeing more and more sick people coming in, because remember, with COVID, generally you start getting sick day 10, day 11, day 12, not always, and with Omicron it's a little different, but the reality is that we expect to continue to see severe illness even though the new infections are dropping. So case rates are dropping, but hospitalizations, seeing people who are severely ill continues. With that, we are also seeing a record number, at least recently, a record number of deaths in the U.S. Every day, news from the last 24 hours, about 2,100 deaths, the data, 2,100 deaths per day in the U.S. That beats the Delta spike from over the summer. So when you think about Omicron and whether it causes, the fact that we know more and more data showing it causes less severe disease, especially if you've received the vaccine and booster, the primary vaccine series and the booster. Remember that because there's such a large number of people infected, there's still a lot of hospitalizations and unfortunately a lot of deaths. I think the other hot topic really is about the vaccine. So are the vaccines effective? Pfizer and Moderna are effective, especially if you get a booster. It will decrease your chances of getting an infection. It decreases the rate of severe illness, and it decreases, really important to us around here in public health, really decreases your chance of transmitting it to others. Your transmission period drops. So more and more data is showing that. We have data from other countries who started their vaccine efforts before the U.S., and they continue to see that. None of that is perfect. I have almost daily discussions with our community talking about, well, that person got vaccinated, but they still got sick. We even have some, not a lot, of people who are vaccinated who pass away, who die from COVID. But your chances, your risk, the probability is a lot lower. Some of the quick numbers here. So as I said, the case rates are down in Solano County. The 7-day average case rate in Solano is about 600 a day. Again, that's from a peak above 900 about 2 weeks ago. If you compare that to what we're seeing in the state, we're seeing about 100,000 cases a day or so, and that peaked about a week ago if you just look at the entire state. Hospitalization in Solano County on Monday was at 162. It peaked at about a little over 200 earlier this week, and late last week. I'm sorry, and that is higher than what we saw with the Delta variant. And some vaccine data for you. Depending on which data set you look at, somewhere between 65 and 70% of Solano County is fully vaccinated. That denominator does include our 5 to 11-year-olds. The good news, that's a little lower. That's lower than many other counties in the area. The good news is that about 96% of those over 75 are vaccinated, although I would love to see that number really close to 100%, because that population is such a risk for getting severe illness, even Omicron. But those, it's good to see that we continue to see a rise in the vaccine numbers. It's not as quick as we would like. The booster demand is out there, but it's also waning, and I think we have a little echo here. I'll put a plug in that that if you are eligible to get a booster, please do. With that, I think one last comment is just about what we're seeing here at NorthBay. As I said, we still see, we're pretty much mimicking the rest of the county. So high hospitalization rates. We still see a lot of cases coming out of when we're testing people, seeing cases going from urgent care and in our ERs. Lots of cases, very impacted. All areas of the organization are very impacted and full. Lots of our admissions to the hospital, not all of them, just a portion of them, are people who get admitted with COVID but not for COVID. So maybe they're sick with something and they have to get admitted to the hospital. We test everybody when they get admitted, but they're found kind of incidentally, like, oh geez, you're COVID positive, but they're not exhibiting COVID symptoms. That's actually, UCSF just put out some data similar to that. They quoted about 40% of their admissions. We might be around there also. It just shows you Omicron's very different than some of the other variants. But the hospital, we have a lot of COVID patients. We cohort them in a similar area, and obviously we're experts at managing COVID in the hospital, and those are my updates for now. So with that, Robin, why don't we go into questions?
Okay, so are we still seeing that the majority of cases are people who are unvaccinated?
Are the majority of cases? No, it's a real mix, and that's because vaccination rates are high, and the vaccine is not perfect, and the vaccine is not as effective against Omicron as it was for Delta and the others. It's still very effective, but we're not as effective. So no, we're seeing a much more mix of vaccinated and unvaccinated. I'll say though that the ones that are going to our ICU, right? There's still the majority are unvaccinated. The ones that get very, 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 very sick.
Okay, so is it safe to say that Omicron is now the dominant variant, and how do we know that?
Sure, that's a good question. So the question is it safe to say that the Omicron variant is the dominant variant in our area, and actually in the U.S. And the world? And how do we know that? And I'll tack on an extra fact for you after that. But the answer is yes. It's something like 99% of all cases. There's robust sequencing in California. So a lot of cases are sequenced. There's priorities for those that are hospitalized or especially if they're vaccinated, things like that. And so there's a lot of sequencing going on, and it's showing Omicron. I think the question that you should have in your head around Omicron is, does getting Omicron protect you against Delta or others? Like, could Delta be down there somewhere and just it's being outcompeted by Omicron? And I don't think there's definitive evidence that shows that answer yet. So I'm saying that to you because there's so many news stories, there's so many titles. It's so hard to keep straight. It's hard for me to keep straight. I'm sure it's hard for you to keep it all straight. But because Omicron's so dominant, does that mean, oh great, like we'll all be protected either with the booster or getting Omicron? And the answer is Delta may be down there also, but we're not seeing it because of Omicron is outcompeting. So that's all. So I think we'll see. There's going to be new variants. I think it's hard to know whether Delta or other variants are gone or just not going to show again. I maybe you know more than I do. I haven't seen any data that shows that we know that answer yet.
Okay. Kathy's asking, are you seeing children infected and sick? And how about under 5 that can't be vaccinated?
Those are good questions. So what are we seeing kids? We're not a dedicated pediatric hospital. We have some pediatric patients, but not COVID. So those get sent to Children's Hospital Oakland, so Benioff, all the other children's hospitals are absolutely full to the brim. We know that from the data that children still are lower risk for getting ill from Omicron, but it's because so many people are getting Omicron, that the kids are getting infected also. And then, of course, a very small percentage, but some of them get severely ill and need to get admitted to hospital. The answer to your question is we are seeing kids in our emergency department who are severely ill from COVID. It's not a lot, and they're being transferred to Children's Hospital. I was in the news, but we had some deaths in Solano County, some kids who got that multi-system failure, MISC. So we have had some deaths of children also. It's tragic, but it has happened. Those numbers remain low, so we have to be diligent. All age groups, if you're eligible to get vaccinated. But yes, we're seeing very young ones and who are under 5 and over 5, and they get transferred to a children's hospital.
How accurate is the testing? Can you get a false negative and then go back a few days later and get a positive? And how often should you get tested?
The question is, how often should you get tested? Are the tests accurate? Nothing has changed that much with testing. We've relied on it more, but when I'll tell you the answer to this one, but I could have said the same answer a year ago. And there's some variation of Omicron and whether the rapid tests are as good against Omicron, but the basic rules are still applicable. The PCR tests that are out there still remain very, very accurate for COVID. Above 90%, very, very good. You need to be in a window when you're going to be positive, but the PCR window is much wider. The rapid antigen tests that you can buy at the market when they're available, that the government just sending to every household in the U.S. for free. Those are a lot less sensitive. You will definitely get a lot of what we call false negatives. So the test is negative, but you still have COVID. Some of the data shows, depending on the test, that if you're at the prime of your illness, very symptomatic, that you're really shedding a lot of virus, that those rapid tests possibly are around 80%. And don't quote me on that. There's different studies that show different things. Earlier on, maybe it's more like 60+%. I mean, those are not amazing numbers, by the way. We don't love having a false negative rate of 1 in 4, 1 in 3, 1 in 5. We would love to have numbers. 1 in 5 is not horrible, but we like better numbers than that. That's why stacking tests, doing 2 tests over 24 hours, is why these test kits come in pairs of 2, right? You can imagine just the mathematics behind it, the probability, it adds to the sensitivity. So if you're really in the middle of your symptoms and you get 2 tests over 24 hours, it's a little better. So they're more helpful when you have symptoms, but they're so easy to do. They're rapid. You can do a few at home over a few days. So honestly, most experts like those rapid tests, including me, because getting a PCR is so hard and it often takes 24, 48 hours to come back, 3 days sometimes. So the answer to your question is if you have a negative test and you're not feeling well, do not rely on that test. Rely more on 2 tests. If you just got to keep testing. If you really feel like it's COVID, it's probably COVID. If you're sick, just be careful. I mean, that's really our instruction to our staff. It's instruction to our families and our friends. If you're sick, stay home, isolate. Sure, go get tested, please, but we're not going to trust a negative test very much. PCR, I would trust, but I might even get 2 of those, or a rapid test and a PCR. A lot of different combinations. The reality is the rapid tests are a good first test. 2 are better than 1. I use them in my family if we're having, if we want to just check on things. Sometimes we do that rapid test. I do trust it. Trust it depending on the whole picture. Is my kid sick? Is my kid not sick? Has there been an exposure? Are we going to do 2 over 24 hours? So things like that really help a lot. So we should use them, but don't rely on it 100%. Think about how am I feeling? Do I think I have COVID? Did I have an exposure? Things like that.
Are the symptoms with Omicron different than the other variants?
Well, that's a good question. Are the symptoms with Omicron different than others? Yes. And I think that's, in some ways, it makes me happy that the symptoms are a little different because there's less loss of taste and smell, which is pretty devastating to people. It doesn't feel good. It feels really weird. And there's more sore throat symptoms. The flip side of that is it feels more like a cold or other viruses, right? It's so hard to tease out. It was already hard to tease out COVID from other viral syndromes, but I think it's even harder now, is what I think. So the answer is yes, less taste and smell, less cough, more sore throat, and I'm sure there's others, but that's a limit of what I have available today.
And are the vaccines effective against Omicron?
Yeah, are the vaccines effective against Omicron? The vaccines are effective against Omicron. They're not as effective, although the booster really helps a lot. Still, the vaccines are very protective against severe disease, somewhat protective against getting Omicron, and definitely help with transmission. They really help in all those ways, and they're safe for 99% of those that are eligible.
If you get Omicron and recover, can you still get it again?
If you get Omicron and recover, can you still get it again? Yes, and there's a lot of stories out there of people getting Omicron twice in a month. You could have gotten Delta twice in a month. Here's why, by the way. We don't know. It's one reason why our government, our regulatory agencies, experts still recommend getting vaccinated even if you've had COVID. No, it's very hard to know what kind of immune response you have to these infections. Many people with Omicron don't really have a lot of symptoms, and some of them may not even be mounting a very strong response to Omicron, antibodies, things like that. Those who are immunocompromised, maybe they're being treated for cancer, maybe they have diabetes, maybe they're on immunosuppressives for other things, immunosuppressive medications for other things other than chemo for cancer. They may not. They may have gotten Omicron and hopefully they get through and do okay, but didn't mount an antibody response. So I'm saying that to you because it's really hard to tell. So I think some of those people who are getting Omicron-like, confirmed Omicron-like twice over a month or twice over a few months probably didn't mount a very strong response. Or they got a breakthrough infection. They got Omicron, they got some antibody response to it, then they got it again and it got past the immune system. So that's why if you throw in a vaccination there and really try to amp up your body to fight the infection, you're more protected that way. And that's one reason why vaccinations continue to be recommended. There were some studies just recently talking about how a natural infection, if you were symptomatic, there is some studies coming out showing you actually have really good protection against the vaccination. The key is that we don't know everybody's response to Omicron. So, but there's a more consistent response when you're vaccinated. So that's where some of those recommendations come from.
All right, let's talk about treatment options.
Sure, treatment options.
There are new oral medications, and I know some have come, but it's pretty limited.
Treatment for strep throat? No, everything is about Omicron and COVID. One day we'll talk about other infections. Treatment, there are a bunch of new treatment options for COVID. I'm going to run the list. None of them are a magic pill. So that's the first thing to know. None of them are. They're not turning out to be, miracle treatment options. But all of them have helped, and the goal is to continue to mitigate, severe illness. Try to flatten that epidemic curve for the for COVID. That's still the goal. That's still the goal as we try to keep our hospitals from reaching those high capacity. First and foremost, there's still some availability of monoclonal antibody. The FDA just kind of revoked the emergency use authorization for Regeneron and a few others because they're not effective against Omicron. They're not dangerous. There's nothing that's changed about them, but Omicron doesn't work for it. There is still there's a monoclonal antibody that is effective against Omicron, and there's very limited supply, but they are available. They're really available for those that are severely ill, with a preference towards those that are unvaccinated, because that's who's going to get the most benefit. It does decrease your chance for hospitalizations by a little bit. They aren't miracle drugs. They're injections also. They require injections, not just pop a pill. So those are the monoclonal antibodies. There are new antiviral oral pills that have been out. Has it been 2 months? Time flies. Something like that. Maybe longer, maybe shorter. By Merck and by Pfizer. I think Paxlovid by Pfizer is the most well-known. They are twice a day for 5 days, kind of similar to Tamiflu for flu. They show some benefit in decreasing hospitalizations. So again, they're pretty restricted to those that are going to benefit the most. High risk, really high risk. Like you are really high risk for getting hospitalized or dying of COVID. There's also a lot of drug-drug interactions where it could change the effectiveness of another medicine that you might be on. So there's also a lot of side effects. Those side effects might be worth it. You may have no side effects from it. The reality is it's a carefully thought out decision to start those medications. They also have to be started within a few days of symptoms, or their ability to impact the hospitalization chances risk goes down. So has to be started fairly quickly, and there are some side effects, and there's what we call drug-drug interactions with other medications you might be on. Careful decision, but it is available. It began with a very restricted allocation. Here at NorthBay, we got really like a few doses, maybe a little more than that, but not a lot at all, like barely any to really talk about. Then slowly, and so did a few other pharmacies and areas, that was all that was available. And then slowly we've been getting a little more here and there. So NorthBay does have it available in certain areas, and we hope to have more availability. But again, the benefit and risk discussion is a discussion with primary care doctors, and we also consult our pharmacists, our brilliant pharmacists, in that decision.
So if you get COVID, at what point do you need to get medication?
If you get COVID, it depends on which medication we're talking about. The monoclonal antibody is most effective. All of them are effective the earlier you start it. Monoclonal antibody is within 10 days of symptom onset, and the pills are a few days in. I have to be honest with you, it's either 3 or 5, depending on which one it might. I would have to look it up. I'm so sorry, but it's within a few days. So the point is, the message is the same. If you're starting to feel sick and you're at very high risk for getting severe illness, reach out to your primary care doctor. And I have to be honest, I just don't remember exactly how many days right now.
For those people who are recovering at home, maybe they don't have severe COVID, how effective are over-the-counter meds like, cough syrups and Mucinex and that sort of thing?
Yeah, the question is do the over-the-counter things work? Yes, for symptom control, the Sudafeds, if you're safe to take Sudafed, the Mucinex and all those things. Yes, if they've worked for you for other viral infections and you're safe to take it, they will be effective against this. Omicron and COVID is a very different virus. When you think of the transmission, the symptoms it causes, but it is a coronavirus. It causes the same impact on your body as other viruses, and these medications work to dry out, or the ways these medications work. If it works for you and it causes some symptom control, then it will be effective.
All right, so you started out your chat talking about the impact on the community and on our healthcare systems. With that impact, what advice can you offer to people on deciding whether or not or when to come to the hospital?
That's a good question. The question is when do I come to the hospital if I'm not feeling well, or other things. So let's see. So first things first, if you feel like you need to come to the hospital and you're not feeling well, let us come and let us help you. The hospitals are very busy. The clinics are very busy. During regular flu seasons, we're very busy. Things are a little different right now with COVID. It is safe to come here. Everyone is wearing masks. We are as careful as we possibly can be between hand hygiene, distancing, and mask wearing. If you need help, we are here. Whether that's reaching out to your primary care doctor, going to urgent care, or if you feel very, very sick and you feel you have an emergency, we want you to come to the emergency department. We have here at NorthBay, and I know other health systems have done it too, during some of the most impacted weeks, we've been postponing some primary care visits and procedures. We've had to do it. It's because we have so many people that are at the hospital sick with COVID, trying to leave beds and appointments open for those with COVID. So if you're not feeling very sick and you feel fine, you don't need care, and you should know that yes, our call center is very impacted, our clinics are very impacted. We hope things will improve in the coming weeks. Because we've gone past the peak of new cases, we hope things will start going down in our clinics and hospitals, but today it remains very busy. So if you don't need care, yes, if you're not going to need medicine or treatment for COVID, then you know COVID, and I know COVID. Mask wearing, isolation, keep yourself well and healthy, and you'll get through it. But if you need our care, we are here for you, and you should come and let us help you. That's what we're here for.
Okay, great. a lot of people, there's discussion out there about, since Omicron is viewed as less impactful and less harsh than Delta, why not just get it and have immunity?
The have an Omicron party.
Yeah.
So the question is hey, I'm just going to get it, so then I'm protected. That's not a good. That's not good, and I'll tell you why for a few reasons. Young people, old people, while COVID, you're higher risk for getting severely ill from Omicron or Delta, and it's less with Omicron. If you a higher risk because you are immunocompromised or you are in the older age groups, while you have a higher chance of getting severely ill, we are definitely seeing young people with severe illness. And I just talked about, honestly, a couple of kids, including a teenager who died recently of COVID. So the risk is less, but you don't want to roll that dice when you don't need to. You don't need to roll that dice. Just go get vaccinated. So the answer is that's one reason not to. I said early in the talk also, we don't know yet definitively how Omicron will impact your immunity to other variants, including Delta before. It's hard to know right now. I'm sure that data will come out definitively at some point, but it would stink to get Omicron because you're trying to mount natural immunity. Maybe you're not that excited about the vaccine, and then you either don't really get an immune response, because remember, it affects people differently, or it doesn't really protect you, or maybe you get severely ill and you get through it, but you're like, ooh, I got through it, and then it doesn't really protect you that much. Or you get a long COVID syndrome and you feel foggy brained and headachy and disgusting for months and months, and it affects your job, or it affects you in school, or you infect other people. I'm sure if you're thinking about doing this, you're thinking about, how do I isolate during that period from grandma and everybody else? But this thing is so stinking contagious, it is really hard to do. Talk to people who've had it. They're like, I was so careful, but it still went to grandma somehow. So those are all the reasons why I would not recommend a COVID party.
All right, great. Well, we're out of time. Just a reminder that we'll be back here with Dr. Kaufman talking some more and answering your questions on February 9th at 10 a.m. And then after that, on February 17th at 5 p.m., we'll have a Doc Talk Live with one of our interventional cardiologists, Mark Villalon, and he'll be talking about heart health.
Ooh, do not miss that. Don't miss my talk, but Dr. Villalon's amazing. Do not miss his talk.
All right.
Be safe out there. Thank you.
Thank you, Dr. Kaufman.